Hello, family. It's Tuesday, the 9th of September, and I'm 1 week out from my eye surgery. And so, if you've looked at this before, you can tell that it's improved in terms of the bruising and those kinds of things. So, I went to the doctor this morning, and I was going to write you all an update. And typing is difficult for me at this point because I still have a brace on my left hand. And so I decided that the best way to do this was a YouTube video. When I went in this morning, he measured my eyes, and the good thing is that this eye is now forward. It was pushed back in the accident, and things basically fell out below the eye. And so what he did is in the surgery, he pulled those things back up and moved the eye forward, and then put a bridge in underneath it. So the eye was drooping slightly and inward slightly, and now it's restored. So it's in a good position, and everything looks good from that perspective. And so essentially today what he told us is that it's just now a matter of the healing process. There's not anything else that he can do for the eye. He did a test. My double vision is slightly improved. When I look up and he asked me to track things, it tracks better than it did. And so there is some response from the muscle. And the hope is that the muscle continues. So I thought that there was something that he could do to tweak the muscle. That's not something that's within his purview to do. Interesting as he described it, we talk about my travel window, and we're trying to have our travel window be as both high and wide as it can be. And he basically said, my goal is to have you be able to see up and down and left and right and have as large a field of vision, normal field of vision as you can. And he said, it's going to take 3 months. So I don't go to see him for another, well, it's going to be 2.5 months, because in 3 months we'll be traveling. And so this part of my eye was numb going in. It's not my eye, my face. It is still very numb. And so I asked him how long before that rectifies itself, and he said 3 months. And so what happens is when I brush my teeth from about here to most of the way on this upper right side, I can't feel anything. I can't feel that. And it goes, part of my nose over here is numb. And so that's a nerve that is just going to take a long time to recover. There will be some landmarks along the way. In about a week, he told me that I can try and use a contact in my left eye. So he said I can use a contact in this eye and see if I can drive at this point, as far as he's concerned, in about a week. If I use a contact in my left eye and close my right eye, because my right eye is not ready for contacts, or if I use glasses and can see okay out of both eyes. And at least in a week, it looks like I will probably be able to drive again. In 3 weeks, I'll be able to use a breathing machine again, because at that point, this will have developed enough scar tissue that there's not any damage that can be caused by the breathing machine. And so I'm to the point, I think in about 3 weeks where I can blow my nose again too. So anyway, and then in about 3 months is when I can look at figuring out what I can do vision-wise, because neither my glasses nor my contacts are set up for my eyes with the vision they have. The right eye used to be my strong eye, and now it's the weaker of my two eyes. And so the problem is that I probably will not be wearing monovision contacts in the future. I'll probably be going to regular contacts with cheaters to read. So, I'm almost 74 years old, so I made it a long ways without having to wear those. And but on the other prospect is to have glasses, but the glasses will have to have new lenses. And he basically said it's a waste of money to try and do any of these things over the course of the next 3 months for long term, because the vision's going to change over that span of time. all in all, it was very good news. It was very positive. The surgery essentially was a success, and just keep monitoring it. I'm going from using ice packs on this to now putting a warm compress on it every day, and yeah, I feel a lot better. I'm off antibiotic, and which makes my system work a lot better. And so anyway, good news from Spokane. And I'm encouraged. Hope you guys are too. Love y'all. Bye.